Okay, let's unpack this. Have you ever noticed how much of life, um, from everyday feelings to major events, now gets talked about in medical terms?
Yeah, it's everywhere, isn't it?
Totally.
Mhm.
So today we're diving deep into medicalization
Mhm.
and how it acts as, well, a powerful form of social control.
That's right. We're exploring this really critical process where things that, weren't seen as medical problems or maybe just normal human stuff, they become defined and treated as medical issues.
Right.
And it's not just about getting a diagnosis, it's more about how society labels and manages all sorts of things, personal behaviors, natural life rhythms, all through this medical lens.
We've got some really insightful material here. It traces the idea back and shows how far it actually reaches.
Hmm.
Our mission really is to help you understand this process, which is often kind of invisible, and what it means for how we see ourselves and, society. So we hear this term medicalization quite a bit, but
Right.
what does it really mean? What are we actually talking about?
Well, at its core, medicalization is basically using medical language or medical ways of thinking or even treatments to define and handle a problem, even if traditionally it wasn't a medical thing at all.
Okay.
And the term itself often has this critical edge to it. It kind of hints at over medicalization, maybe going too far.
Yeah, and the examples are pretty eye-opening. You mentioned things like childhood hyperactivity or even alcoholism.
Exactly. Things once seen simply as, badness or maybe a moral issue.
Right, a failing.
Yeah, and they gradually shifted into being understood as sicknesses, as medical conditions.
And it's not just stuff we might call deviant behavior, is it?
Yeah,
It's like normal life stuff, too.
absolutely. Natural life processes get pulled in. Childbirth, aging, menopause. These are now heavily medicalized areas.
So where does the power in this actually come from? Is it just doctors deciding things?
Well, the power really lies in defining the problem. That's key. And medicalization can happen on different levels. Conceptually, for instance, just using medical words like gender dysphoria becomes the way we talk about certain experiences of gender identity within a diagnostic framework.
Okay, so the language itself shapes it.
Precisely. Or it can be institutional. You have organizations adopting a medical approach, maybe using medical logic, even if the day-to-day work isn't done by doctors or nurses. And then there's the interactional level, that face-to-face doctor-patient meeting, like prescribing tranquilizers for what might just be, say, an unhappy family situation.
Ah, okay. So it's not always the medical profession, like, deliberately trying to expand its influence then.
That's a really important point. No, not always. While doctors in the medical field obviously have a lot of sway,
Sure.
other groups matter too. Organized lay interests, even patients themselves can push for medicalization. Think about advocacy groups who fought for PTSD to be recognized as a diagnosis.
Right, post-traumatic stress disorder.
Exactly. Or historically, think about how women sometimes actively sought medical definitions and interventions around childbirth. It makes you ask, okay, what are the bigger social effects when more and more life gets framed this way?
Yeah, that is the critical question. Because when you dig into those broader consequences, our sources talk about a potential darker side. This idea that medicalization can sort of individualize problems that are actually social at their root.
Right. It takes the focus off society.
Exactly. It can depoliticize behaviors, shift responsibility away from, say, social structures or inequalities, maybe distract from those underlying issues, like a learning disability theory might accidentally mask how school practices or social hierarchy affect a child rather than challenging those things.
It essentially puts the problem inside the individual.
Yeah, it's like saying the problem is you, not maybe the problem is us or the system.
But what's really fascinating, too, is that it's not always a one-way street into medicine. We also see the opposite, demedicalization.
Demedicalization. Okay.
Yeah, where problems actually lose their medical definition, they get reframed.
Can you give us a clear example of that happening?
Sure. The classic one, certainly in the U.S., is homosexuality.
Ah, right.
Through years of organized protest and activism, the American Psychiatric Association voted back in 1973 to remove it from the list of mental illnesses. That fundamentally shifted how it was seen more towards a lifestyle, an identity, not an illness.
That was a huge shift.
A massive shift. And another, maybe quieter example, think about the trend of single women using turkey basters for artificial insemination at home. It's a personal act, but it bypasses the medical system, right?
Yeah, it sidesteps the fertility clinics.
Exactly. And in doing so, it subtly challenges the idea that fertility has to be a purely medical domain. It kind of demedicalizes it in a small but powerful way.
Wow. Okay, so things can move out of the medical sphere, too. It makes you really rethink what counts as medical.
Yeah.
So what does all this mean for us, day to day?
Well, the evidence does seem to suggest that medicalization overall has happened much more than demedicalization. Things tend to move into the medical realm more than out.
Okay.
But just understanding that this push and pull exists, this two-way process, it lets you look more critically at how we categorize things in society, how these labels get created, how they get challenged, how they change.
Right, it makes you look under the surface.
Exactly. It pushes us to think about the cultural forces, the structural factors that are really shaping our lives, maybe more than just a medical diagnosis might suggest.
So as you go about your day,
Yeah.
maybe you'll start noticing those moments
Mm.
where life's complexities are getting maybe quietly labeled and managed medically.
Or maybe where old definitions are starting to loosen up.
Yeah. And what would it take to, demedicalize some things? Definitely something for you to mull over until our next deep dive.